On this edition of Veterans Health Watch, we'll learn about celiac disease and the importance of a gluten-free diet in managing this disease. We'll also learn about colorectal cancer and speak to a colon cancer survivor. So please join us. Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. Over the last couple of years, we've heard a lot about celiac disease and the importance of living a gluten-free lifestyle to help manage this disease. And here to talk to us more about this subject is Dr. Megan Willard. She is a gastroenterologist at the Baltimore VA Medical Center and Associate Professor of Gastroenterology at the University of Maryland. Dr. Willard, thank you so much for joining us.
Hi, thanks for having me, Kenya.
Well, let's start with the definition of celiac disease. Can you tell us more about it?
Sure. Celiac disease is an autoimmune disorder where the body attacks itself when someone eats gluten, which damages their small intestine. I think of the small intestine as a high pile carpet, lots of little fingers out into the intestine to absorb nutrition. And celiac disease actually makes it look like a tile floor. It flattens it completely and interferes with absorbing your nutrition, your vitamins, your minerals.
And so those little fingers you're saying those are necessary to absorb?
Exactly. They're necessary to absorb nutrition. And this is actually more than a food allergy. It's not a food allergy. It's not a food sensitivity. It's a true disease where there is damage to the intestine.
And so what is gluten?
Gluten is a protein that's found in mostly foods that are made up of rye, wheat, barley, and oats. It's a natural protein. No human can digest that protein. None of us can. We just don't have the enzymes to do that. But in celiac patients, there's an autoimmune response to this undigested protein as it tumbles its way through our intestines. And the autoimmune response causes damage to the small intestine.
And you mentioned that this is a protein, so it's nothing new, but do you have any insight into why it's so prevalent now? And we see commercials about treatment, we see products that are gluten-free.
Right. The estimate is about 4 times more common now than it was 50 years ago. Why that is, I don't think anyone knows. There's a lot of people who think that maybe it's related to this hygiene hypothesis. We're such a clean environment now that our immune system really has nothing else to do with itself, and that we never see parasites, those sorts of things. And so it ultimately turns on itself and it starts attacking itself. Maybe we're looking for it more, I don't know. 20, 30 years ago, maybe no one thought to look for it, but now most GI doctors look for it for very minor symptoms. Then there's a thought, too, that maybe we process our wheat differently than we had in the past, and that may play a role.
So what are some of the symptoms to celiac disease?
There's many. There's many symptoms ranging from GI symptoms all the way to neurologic symptoms. The most common GI symptoms would be diarrhea, chronic or just recurrent diarrhea, bloating, abdominal pain, nausea. And these symptoms, the GI symptoms, don't necessarily have to correlate with actually eating the gluten. They can occur randomly as long as gluten is throughout the diet. The non-GI symptoms vary from chronic headaches, anemias, bone loss, arthritis, burning and tingling in your hands and feet, infertility, abnormal liver enzymes. The list is very long. And
it kind of crosses the spectrum for other issues, so you definitely want to see your doctor at a certain point. We'll get back to that. But how you treat veterans? How common is this disease among the veteran population that you treat?
I would say it's probably not any more common among the veterans than it is in general population. We estimate that about 1 in 100 people actually have celiac disease, although not 1 in 100 patients actually have symptoms. Large population-based studies put that estimate at that number, but most people don't have symptoms. Certain people are at more risk for celiac disease. If you have a primary first-degree relative with celiac disease, that would be a mother, father, brother, sister, child. The risk of you have about a 1 in 10 chance of developing celiac disease when you have that family member with it. Then there are certain diseases that increase your risk, type 1 diabetes, certain autoimmune thyroid or liver diseases, Down syndrome. All of these conditions have a higher incidence of celiac disease amongst them.
And what should a person do if he or she, we heard about the symptoms, if they feel they have those symptoms, when do you then say, okay, I think I need to talk to a doctor?
I think that if you have any symptoms of recurrent diarrhea, malabsorption, a lot of the irritable bowel syndromes are often misdiagnosed as irritable bowel syndrome when actually it's celiac disease. If you have any unexplained anemias, chronic infertility, multiple low birth weight babies or frequent miscarriages, abnormal liver enzymes, an anemia that's unexplained, all of these things should prompt you to talk with your primary care doctor to see if you're someone who should be tested for celiac disease.
Okay, great. And what about what types of medical tests are performed to determine if someone has this disease?
There's some blood tests. The main one we use to screen patients is an anti-tissue transglutaminase test or an anti-TTG test. It's a blood test that's readily available. The supermajority of patients with celiac disease, it will be positive in those patients, so it's a good place to start. There are genetic tests available. Almost 100% of celiac patients have the gene test positive. Ultimately, there is a small bowel biopsy that we can do, which we do through an upper endoscopy. You come into our GI lab, we sedate you, we put a scope into your small intestine, take biopsies, and let the pathologist look at them under the microscope and determine if you have celiac disease.
And I'm sure as a clinician, that's not your first course of action if anyone comes in with those symptoms.
Right.
So when do you do?
That would be if this blood tests are positive, you certainly should get the upper endoscopy.
Okay.
Unexplained anemias definitely usually get an upper endoscopy. Symptoms, if you have a negative test but you're overly suspicious, they should prompt for an upper endoscopy as well.
Great. Didn't want people to think that was going to be the first thing that gets done. So we talked about living a gluten-free or having a gluten-free diet in the beginning. What are the treatment options, I guess, for celiac disease?
Gluten-free diet is the only treatment right now. That's easier said than done. It's a very difficult diet to follow. It can be rather expensive. You have to remove all foods from your diet that contain rye, wheat, barley, and oats. Certain foods are naturally gluten-free, fruits, vegetables, meats, unprocessed meats, I should say. Those things are naturally gluten-free, so that's easy to incorporate. But then there are gluten-free options of cake and bread and pasta available that you can get. You just can't eat the foods that contain rye, wheat, and barley. Like I said, it's easier said than done because it's pricey, and sometimes they're difficult to find depending on where you live in the country. You have to really be a label reader when you have celiac disease. Gluten hides in a lot of things you wouldn't think of. Like Twizzlers, for example, have flour in them. Who would have known Twizzlers are not gluten-free? Gravies, sauces, beers, yogurts, salad dressings, anything with modified food starch you should avoid.
So you said you need to be a label reader and really take it seriously. What complications can come from having this disease if you don't follow a gluten-free diet?
The most feared complication is cancer, small bowel cancers in particular. Small bowel cancers are not very common in general, but celiac patients who don't follow a gluten-free diet are about 20 times more common, 20 times more likely to develop the cancer than other patients. Any symptoms that you have will continue. Your diarrhea will continue, your bloating, your bone loss will continue, your anemia will persist. All the vitamins and minerals you are not absorbing will continue to not be absorbed, and all the problems that result from that.
And where can someone learn more information about this disease and how to manage it?
There's lots of websites. My favorite one is celiac.org, and they have a lot of information on there for everyone. where to get gluten-free products, what is gluten.
Well, thank you so much, Dr. Willard, for joining us today and kind of giving us some insight into this disease and why we see so many gluten-free products on the market. So we hope that the trend will continue to help people to better manage this disease.
Yes, thank you, Kenya.
We're going to take a short break, but when we return, we'll learn more about colorectal cancer, and we'll also talk to a cancer survivor, so please join us.
Volunteering is an opportunity to show your patriotism.
Most importantly, it's a good feeling knowing that you're helping those who have already served.
And it's always an honor and a privilege to me to be there because I know that I get to help the men and the women who have served us.
So if you're interested in volunteering with us, best thing is to get in contact with us through our webpage, or you can also call us.
It really, really gives me an opportunity to give back, make a difference.
Our veterans put everything on the line to protect our freedom. We may never be able to repay them for their sacrifice, but we can show them just how much we appreciate all they've done. Every day, hundreds of people just like you volunteer to help our veterans. You can help by simply sharing your time, lending a warm smile, a supportive hand, or a sympathetic ear to someone who needs it. Everyone can do something to make our veterans know how much we appreciate their service. What will you do?
Welcome back to Veterans Health Watch. Joining us to talk about colorectal cancer, the second leading cancer killer in the United States, is Dr. Eric von Rosenbing, the Chief of Gastroenterology for the VA Maryland Healthcare System, and Mr. Nathan Chapman, a colon cancer survivor and Air Force veteran. Thank you so much for joining us today.
Thanks
you
for having us.
Dr. von Rosenbing, let's start by talking about or describing colorectal cancer.
Well, colorectal cancer is a cancer that starts in the large intestine, which includes the colon and the rectum. Colon cancers can grow and spread throughout the body and can cause serious illness and even death. It's estimated that 1 in 20 Americans will develop colorectal cancer in their lifetime, and the American Cancer Society estimates that about 50,000 Americans will die from colorectal cancer this year. To put this in perspective for my veteran patients, I like to point out that more Americans will die from colorectal cancer this year than died in the entire Vietnam War.
Well, let's see if we can educate our audience about this, to see if we can change those numbers. What are some of the symptoms of colorectal cancer?
Well, it's important to point out that often colorectal cancers don't have symptoms, especially in the beginning, and that's why it's so important to get screening. But when symptoms do develop, they can include a number of things, such as abdominal pain, bloody bowel movements, unexplained weight loss, new diarrhea or constipation, or symptoms of anemia or low blood counts, which can include excessive fatigue or shortness of breath with exertion.
How can one decrease the risk of getting colon cancer?
Well, having a healthy diet, one that's high in fruits and vegetables and low in fats and red meat, staying physically active, and avoiding smoking and excessive alcohol can all reduce one's risk. But even more important is regular colorectal cancer screening.
And okay, so when we talk about screening, can you tell us about the different types of colorectal screening and when should a person have this screening?
Sure. So colorectal cancer screening has been shown in a number of studies to be very effective at lowering the likelihood of dying from colorectal cancer. And we know that if we find a colon cancer during a screening procedure, before someone has symptoms, it can be cured over 90% of the time. We recommend that all Americans and all veterans age 50 to 75 get regular colorectal cancer screening. And if you have a family history of colon cancer, it should often begin even sooner. There are a number of options for colorectal cancer screening. The two most commonly used are colonoscopy strategy and test for microscopic blood in the stool. A colonoscopy is a test whereby a long flexible tube with a light and camera at the end is passed through the large intestine. Colon cancers can be identified, biopsies can be obtained, and precancerous growths called polyps can be removed. Tests for microscopic blood include the old-fashioned stool cards that people are familiar with, and we also, as of last fall, at the VA Maryland Healthcare System, started offering a new, even better test called a fecal immunochemical test, or FIT test. And this test is much better at identifying colorectal cancers and only requires one sample as opposed to the old stool cards, which required 3 samples. Which test is right for an individual in part depends on what their other medical problems are and what their personal preferences are. And that's why it's important for veterans to talk with their doctor, to have that conversation about what's the best approach for them. And I like to tell people that the best test is the test that gets done.
Yeah, and that 90% success rate is a good reason to do it.
Get screened, yep.
Mr. Chapman, can you tell us about your experience and what led you to seeking your services through the VA Maryland healthcare system?
Well, I started to have just a funny feeling in my side, and it was kind of something that was, for me, very unusual. You know, I do a lot of working out, and I was a vegetarian, and I stayed in a health club. So I thought I knew my body, and something was just off. And I put off having colon cancer kinds of checks, colonoscopies, and so on, because I had a fear of being put to sleep. And what I found out was that wasn't necessary. So if you elect, they will allow you to be awake doing the procedure. And of course, that's what I did. So when I actually went in and I did that, and they said that I had colon cancer, I was shocked, but I was awake. And I saw the colon cancer at the same time they did. So I was able to immediately move into the action phase.
So it's good to know you have options. So you don't want fear to paralyze you from, like you said, just taking that step and getting the screening done.
And it was that fear that really kept me from going in the first place. You know, I took the test that didn't involve anesthesia. I had the stool sample where you have to send it into the mail, and that was fine. And I said, well, I'm probably fine. And I didn't have any weakness. In fact, as I mentioned, I was at the gym and doing all kinds of weightlifting and pull-ups and things. And there was certainly no blood in my stool, and all that was fine. But I still just had that funny feeling. So when I actually went in to get the colonoscopy, I fully expected that everything would be fine. And unfortunately, it wasn't.
But you are here with us today, so tell us about the treatment options or the treatment that you had to go through.
Well, when I was diagnosed, it led to surgery because my colon cancer had reached stage 3. And what happened was I had a 3.5 hour operation, almost 4, where they took out half of my colon. And then they took out about 30 of my lymph nodes, and in a couple of those, they found evidence of cancer cells, which meant that I had to get the chemotherapy. Now, when you look at the colon cancer journey, the surgery, the nearly 4-hour surgery, and then the recovery period before they can even start chemo, and then the chemo treatment, which is 6 months worth of treatment, all that because I had a fear of being put to sleep. When I was listening to the doctor, he is 100% right. What I went through is avoidable. And that's the message that I want to give to veterans. Get checked because what I went through is avoidable. It didn't have to happen.
Get checked at, you said age 50 is when you recommend people start?
Age 50 to 75 is our target group for screening. Although if you have a family history of colorectal cancer or a personal history of inflammatory bowel disease or colorectal polyps, then we do recommend often to start at an even younger age.
And Mr. Chapman, how are you doing now?
Well, I've had all the screens to say that I'm cancer-free. I mean, that's the end of the process. You go through all of the procedures, the surgery, the chemotherapy, and you get the scans and the blood tests that'll evidence whether or not you still have any cancer left in your system. And as of today, thank God, I'm cancer-free and moving back to my life. But even after the fact, most people think that that's over. But there are side effects to chemo that you still have to deal with even when you're off chemo. And there's side effects potentially to the surgery that you deal with. So it's a long process that you go through that is potentially avoidable if you just come in on the front end and get a simple test, if you don't have the fear that I have. And that was and now, by the way, I have to have a colonoscopy every 6 months, and then eventually I'll have one each year. So for what I was afraid of, I now have to go through for the rest of my life.
And you had to face that fear. You faced that fear. And Dr. Von Rosenving, what lessons would you think a veteran should learn from Mr. Chapman's experience?
Well, first I'd like to commend Mr. Chapman for getting that screening done, getting that colonoscopy, for keeping a positive attitude throughout this whole journey. And I'd like to echo his sentiment that veterans really need to get screened to try to avoid some of the things he's had to go through.
And they should they go through the primary care doctor, or what process should they?
That's the best place to start. Talk with their primary care provider about what is the right thing for them, what are their options, and then together they can make a joint decision. Should they be referred to a gastroenterologist like myself to have a colonoscopy type screening, or should they have a test for microscopic blood or a different type of approach?
And Dr. Von Rosenving, you mentioned that you were with us on Veterans Health Watch a few years ago, and you mentioned a study that you were starting at the Baltimore VA Medical Center. Give us an update about that.
Correct. So the study is called CONFIRM, and it's taking place at 42 VA medical centers around the country, and it's comparing 2 different strategies, the 2 most common strategies for colorectal cancer screening, the colonoscopy strategy and a test for microscopic blood called the FIT test. And we're trying to enroll 50,000 veterans into the study nationally, and a little over 1,000 here in Maryland. And the veterans are randomized to one of the two different approaches, and then we're following them for 10 years to see which approach does a better job of preventing death from colon cancer. And that's what we're all about. We don't want any veterans or anyone else to die from colorectal cancer. And in a lot of cases, we believe we can prevent it. We know we can prevent it. And we're trying to see, is one of these approaches for screening even better than the other? To date, we've enrolled over 500 veterans in Maryland and over 25,000 nationally, but we still have a little ways to go because we're trying to get up to about 50,000 nationally. So if there are any veterans who are age 50 to 75, are due for colorectal cancer screening and are at average risk for colorectal cancer, we'd love to have them in the study. They can either be referred by their primary provider, or they could call our gastroenterology office at 410-605-7299 and ask for information about the study.
And they could actually help a fellow vet.
Absolutely.
With this study.
That's
Well, Mr. Chapman, thank you so much for sharing your story.
Thank
It was
you.
very brave of you to share this. I'm sure it will trigger someone to take that step. Dr. Von Rosenving, thank you so much for your expertise. We really appreciate the two of you coming on with us today.
Thank you.
And I'd also like to thank the people at the VA hospital, the staff, the nurses, the doctors that took time to work with me, the professionalism, the respect. This is a difficult thing to deal with, and I can tell you that no one took it for granted, even though they deal with it every day as though it was a small matter. They were outstanding, and I just want to say thank you to everyone.
Mr. Chapman, I'm sure the employees of the VA Maryland healthcare system will really appreciate your sentiment, and it's what they do. We'll take a short break, but when we return, we'll highlight a video that gives an overview of the VA Maryland healthcare system and the services it provides to Maryland's veterans. So please rejoin us.
As a nurse, it's very important for me to see a friendly face when I come into the hospital.
I really didn't think I was qualified because I didn't have a service-connected disability.
Recognized for its state-of-the-art technology and quality patient care, the VA Maryland Healthcare System is a progressive organization that provides a full continuum of care to veterans. The VA Maryland Healthcare System is committed to serving the needs of veterans at 8 locations throughout the state.
At the VA Maryland Healthcare System, we're proud of our investment in technology because it's an investment in our veterans.
The categories of care have been opened up so that more veterans can qualify.
Tell a vet to call 1-800-463-6295 extension 7324 to inquire about enrolling in the VA Maryland Healthcare System.
When I came home from my military service, I knew that I needed help, and I went to the VA and they were there for me.
Welcome back to Veterans Health Watch. We recently produced a video that provides an overview of the VA Maryland healthcare system and the safe, quality, and compassionate care it provides to veterans throughout the state at 9 sites of care. So please take a look.
The service that we provide at the VA Maryland healthcare system is among the best in the state.
We are committed to quality, safe, and compassionate healthcare to the veterans we serve.
They do all that they can possible to make sure that the veteran is comfortable and have all their answers addressed, their needs met. I wouldn't choose to go anywhere else.
The VA Maryland healthcare system has 3 main campuses where we deliver medical care.
And also 6 outpatient clinics, which are conveniently located around central and eastern Maryland.
All these facilities provide a broad array of services.
The services that the VA Maryland healthcare system offers includes primary care, ambulatory medicine, oncology services, women's health services, surgical services, mental health services, pharmaceutical services.
The surgeries, the laboratories, the hematologic, the oncologic, the cancer therapies, all of these are expressions of our desire to make sure that every day our patients get the best care possible.
Our healthcare system changes year to year and through time. So we do see ourselves as a modern healthcare system that's constantly adapting.
We're seeing a much younger generation of veterans who are coming through the door today, and we're also seeing a larger percentage of women veterans who are coming in. And the VA Maryland healthcare system is leading the way to adapt to that change and to provide the types of services that our younger veterans are looking for, while still serving our veterans as they age.
Here we developed a women's clinic that worked in conjunction with the primary care clinic as well, and we cared for women veterans, and that program has just grown enormously.
The VA Maryland healthcare system uses technology and in many cases at the forefront, cutting edge, including electronic medical health records, one of the first systems in the country to use that, and we very much depend on that. We're virtually paperless.
One of the exciting new transitions that we have here in the VA Maryland healthcare system is our use of telehealth technology. And this allows our veterans to be at home but still check in with their medical team to provide data such as how their blood pressures are doing, how they're doing with mental health disorders.
We are certainly a leader in education because there are a large variety of programs that train with us.
Our students, residents, and fellows are training here side by side with us, taking care of our patients. And what that leads to is our veterans receiving really cutting-edge care.
The servicemen, the servicewomen who have served in our nation's armed forces are cared for in a respectful and in a state-of-the-art way.
The VA Maryland healthcare system distinguishes itself because we have a mission, and our mission is to take care of our veterans and their families. Our staff are really the linchpin, the key to that mission.
Many of our staff here are veterans themselves. Our staff come from all over the country, from all walks of life.
They are very involved with the patients, very compassionate about the struggles that patients may have health-wise or otherwise, and really work really hard to help them to overcome that.
They know how to laugh, they know how to cry, and they know how to advocate for their patients and their families. They do all that in an incredibly human and caring way.
Just to be able to come to work and to work with veterans, whether I know who they are or I've never met them before, gives me a great sense of honor, and I really feel like I'm giving something back to our country. And I would encourage all of our veterans and our family members and anyone who might be watching to let a veteran know that you've served and you do have benefits, and you should go to your local VA and inquire about your eligibility for health care services. Please don't sit out there and think that the VA can't serve you. You served, and we would like to serve you now.
Well, we hope you learned more about how the VA Maryland healthcare system operates. That wraps up this edition of Veterans Health Watch. If you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-463-6295, extension 7101, or visit us on our website at maryland.va.gov. You can also join us on Facebook or Twitter. And remember, if you know a veteran or you are a veteran who is not using the VA Maryland healthcare system, please call us at 1-800-463-6295, extension 7324. Visit our website or stop in at one of our VA Maryland healthcare system facilities. We'd love to serve you. Please join us next time.
The VA Maryland healthcare system pharmacy is second to none. The copay is minimal. The wait time is as good as you would find in a civilian pharmacy. There are various ways our veterans can access pharmacy services. One is just come to the window with their prescription. Two is through a MyHealthyVet, the internet. They can get their prescription through the phone or through our consolidated mail-out pharmacy. We're very proud of our pharmacy services. We're patient-focused, and we want them to come and see us and what we can do for them.